Hello, I'm Frank Congelos. Welcome to the Institute of Responsible Wealth. Our guest today is Mitch Kaye, MedClaims Liaison, CEO. Mitch had started an interesting business a couple of years ago with his wife, and it has to deal with medical claims that are not being handled properly, covered well, and so forth. And it's one of those areas where once you're in the middle of it, it's you got a problem. And so, Mitch, why don't you tell us a little bit about your business and what it is that you're doing and how you help people?
Happy to do so. So, as Frank mentioned, we started the company in 2009, and this was a hobby of my wife Nancy's, who is an advocate, and at the core of the business is advocacy. We identified the fact that it is a universal issue in America that every family either has had the problem themselves or knows somebody who has had the problem, dealing with the insurance companies not reimbursing what they should be reimbursing on behalf of that family's care. What we do is work on behalf of families to make sure that they pay only what they owe, and that the insurance companies and the providers are only billing what they should be billing or paying what they should be paying.
Mitch, as you're saying that, one of my questions for you is that what percentage of claims that people has as it relates to medical and so forth are not handled properly? Because you would think that people have coverage and everything else, and they know what their coverage is, and that they look, and there should only be a little bit that's not covered. What are you seeing? What's the actual number?
Yeah, so interesting question. The American Medical Association has published statistics recently which show that up to 1/4 of all medical claims are improperly denied once filed for reimbursement. So that 1 out of 4 rate is an astounding number and represents hundreds of billions of dollars of money that is at issue and is left on the table. There are other similar studies that have been done over the last couple of years, including one very substantial one by Kaiser Permanente, which also shows a rate of 20% or greater of claims being improperly administered by the big payers. What's particularly concerning from the standpoint of patients is that 1 out of 10 patients who has a claim that is denied ever files for any kind of an appeal, which means that 90% of the patients who have had a claim denied improperly are not following up on that claim, which means that there's a lot of money that people are leaving on the table.
Mitch, why would it be that you have insurance, you go to your doctor, you go to the hospital, you come out, you presented your card, you think you did everything right, and all of a sudden you get a balance bill for $30,000 or $10,000. Why does that occur, and where's the disconnect there? How do I end up with claims that aren't covered, and how do I end up with this mess that I can have on my lap?
Yeah, so I think one of the key issues is that insurance, health insurance generally, is viewed by a lot of people as an entitlement, and I think there's a real lack of understanding, just as there is with the tax code, about what really is going on. Every insurance company has different health plans that they administer to employers, which select plans on behalf of their employees. You've got 100 different insurance companies around the country. You've got small employers, medium-sized employers, large employers. You've got retirees, you've got people with complex illnesses. These are big contracts, and we have not really found very many people who have read those contracts. And what's interesting is that if you really consider how much money people spend on insurance, over the course of many decades, families spend hundreds of thousands of dollars on insurance premiums alone. And this is the second or third largest single expense that any family will have during the course of their lifetimes. And if I were to say to you, you're going to spend $250,000 on something, you'd think that you'd read the contract. But most families don't ever read the insurance contracts. And then when there is an issue that arises, they're ill-prepared to really understand what they have.
You know, it's interesting when you say, you know, read the contracts, because what I've seen over years being involved in some of the, you know, medical insurance industry and providing benefits for companies is typically someone only sees a summary of benefits, and it's a very lukewarm summary at best sometimes, which is what's your copay, what's your deductible, what's your, you know, what's your prescription drug card. So the, you know, level of knowledge for the average person is very surface level. They typically are not reading in the contract because they're thinking that they have the basics done there. Mm-hmm. And so my guess is that's where it starts. And the other thing that we've noticed over the years is, you know, medical insurance costs have been going up 15%, 20% a year for a lot of companies. And so it's not uncommon, I would think, that people are switching and changing their coverage every year. If they're not changing benefits, they may be changing companies. So contract-wise, you know, my guess is from what you're saying is that's one of the issues. But is there more to it as far as, like, what about when a doctor's office sends in the claim, or even when, you know, the insurance company receives a claim? Is there a disconnect there? Is that where you're seeing it? Where are you seeing it?
Yeah, so it happens all over the place. You know, the insurance companies are part of the issue, but doctors' offices and hospitals, large health systems, are just as much to blame as the insurance companies for mistakes. And we actually see a great number of cases, probably half of our cases, involve a doctor's office billing a patient for something that the doctor's office should not be billing the patient for. So as an example, and this is a recent anecdote, we have a client who has cancer and was treated at one of the major U.S. Cancer hospitals. The health plan denied coverage for the care for a coding issue. And they sent an explanation of benefits back to the cancer hospital saying we cannot approve payment because the coding was improper. All the insurance company was saying to the hospital was resubmit with the proper code and the patient will be covered. Instead of doing that resubmission, the cancer hospital sent a balance bill to the patient for an amount that was in the thousands of dollars. And the patient who has cancer received that bill, saw the remittance slip at the bottom of the balance bill, even though they weren't obligated to pay it, thought that they owed it, and suffered a great deal of stress. So this wasn't just a financial issue, this was almost a wellness issue because of the stress and strain that was put on this person's psyche. And that happens a lot.
It's a shame because it's one of those it's one of their more vulnerable times. You're not feeling well. Okay, most people never read their contract from what we're finding out. And here they are now getting hit financially out of the blue, thinking that, you know, maybe, or thinking I had coverage, I was covered, and all of a sudden it's like, I owe how much money? Right. And so now the stress level is going up, and then their options are what? What do they do at that point when that occurs? What can someone do to fix that?
So what people typically do is they either get angry or they get afraid. And what we typically see is that a single bill gets stuck into a folder and put away, and that single bill in the folder becomes a stack of bills, and that the folder becomes a shopping bag, and these things get put in the closet and lead to a lot of stress. What can be done is, if one wants to really be very thorough, is first things first, read your plan and understand it and speak to your employer about it, or whomever your advisors are, before you have a problem. Know that when you are paying for something, it entitles you to certain benefits. And you should understand what those benefits are before you have that perfect storm of illness and depression and the other things that go along with it. But once you have these issues that have arisen, I think what you do is you get on the phone and you speak to your doctors. If you're being treated at a hospital, typically there will be a social worker who can help guide you through the issue or the issues. You get on the phone with the insurance companies, and you have to work. It's not much different, again, using the tax analogy. Anybody can file their own taxes, but it requires work and it requires expertise and it requires understanding. But it can be done.
Now, that being the case, and, you know, my experience of years of dealing with, you know, people and their planning is that most people, as it relates to these contracts and even having the stamina to hang in there and go through this claim process, it doesn't happen. And what you did was you found an opportunity in that where you can help people and become an advocate for them.
Yes.
So in that being the case is, what is it that an organization like yourself does that you can do for someone when they have this? So in other words, if I'm sitting there with my bag of stuff and problems of claims that came in, I didn't do anything with it, and so I'm getting the calls, they're threatening my credit, maybe they're placing liens or they're thinking they're going to place liens on things, and I have that stuff and I come to you, is that what you do? What is it that you're going to do with that bag at that point, and how can you help me?
Yeah, so I think whether it's us or any quality advocacy organization, we're all advocates. So what we're really after, any advocate, is about getting the right result. And so the right result requires going through and looking at that entire bag, analyzing what you have had done to you, what treatments and therapies you've been given, what your plan covers, and making sure you've been billed properly. If you haven't been billed properly, it's a matter of going back to the providers, doctors and hospitals, and causing them to re-bill at the right rate. Sometimes it's negotiating a bill if a family can't afford to pay the existing bill. And we negotiate, as do other advocates, with both doctors and collection agencies if it gets to that point. And also looking at what's been submitted to insurance companies. And if the insurance company has not given you back the right answer, it's filing appeals. And it can be 1 and 2 appeals to the insurance company directly. And if the insurance company still is not behaving properly, it's appealing to the state governing oversight commission or whatever the independent body is that oversees appeals when there's a dispute between an insurance company and its member.
As you go through that process, and you've been doing this for some time now, as you had indicated, sort of with you and your wife, what type of numbers have you seen? Is it a $1,000 claim, or is it a $100,000 claim? What are some of the examples that you might have that you've seen claim-wise?
Yeah, so there's 2 types of client types that we see. There are those who have had an idiosyncratic event, a severe injury or a surgery, cancer or an accident, and there could be tens, if not hundreds of thousands of dollars of bills related to that incident. And then we have families that come to us where there is a chronic condition. We do a lot of work with families who have children on the autism spectrum or children with special needs, where there's a need to pay for care over a long period of time, and where one bill may only be $90 or $200, but they are going to see the same provider multiple times a week over a course of many years. In each of these cases, the amounts are typically in the several thousands of dollars all the way up to hundreds of thousands of dollars. And we have had a wonderful success rate at getting money back for families. It's not always 100%, but it's getting money, it's finding money and putting it back in the family's pocket, and also saving them the stress of dealing with these issues.
And when you talk about the stress, to me, when I've come across people that have had these issues going on, that's one of the biggest things, because if the number's large enough, they're thinking to themselves, on top of being unhealthy, now I'm dealing with potentially bankruptcy or liens being placed on my home, whatever, by these people. And it's nice to know, just based upon what you've indicated, that there are organizations out like yourself that can help them. I guess my last question for you is, how do people work with organizations like yourself? Are they typically retaining you? How does somebody compensate an organization like you to help them to do this?
The advocacy organizations that are out there or who have been out there historically charge by the hour. Our view as we look at the market is that people don't necessarily know how much time it's going to take to work on their behalf on an issue. So we've tried to create a little bit more of a choice for families, and so we will charge by the hour, but if families like, they can pay a pure contingency. They can give us that shopping bag and we can go to work, and if we get the money back, they pay us a percentage of what we recover, and if we can't recover anything back, the family hasn't paid anything at all. It's been our risk.
So someone who thinks that they've done everything that they can, they've gone through the bag themselves, they've worried themselves, they sat there at 4 o'clock in the morning, what am I going to do about this? Those individuals that have gone all through that and they've still come to the end, they go, geez, I just don't know what to do. If the fact is that they don't have the money to start spending per hour, there are organizations like yourself that'll do it on a contingency and say, hey, if we can help you, it's going to be great for you and it's also good for us. So it's kind of that win-win mindset. That's
Absolutely.
what it sounds like to me.
Yeah.
So when I hear that, I kind of look at it as like, anyone who's got medical issues, medical claims out there that aren't being covered, it would be silly not to pursue it, to see if it's something that you can help. And my guess is they walk in with their bag and they go, and you'll tell them up front, I think I can help you, or I can.
Yeah, and ironically, the more organized a family is or a client is before having met us, the more work they've done and the more failure and frustration they've had, those are the cases where we've actually been even more successful. It's the people who think there's no way in the world we can possibly help them. Those are the ones we end up helping the most, which is interesting.
I think that's great.
Yeah.
Well, Mitch, it's really been a pleasure having you on today to discuss how you help people. And again, on behalf of the Institute of Responsible Wealth, we thank you for the time that you spend with us. We hope that this has been a great resource. Have a great day.